Anticipatory grief. What it is and how to cope. Anticipatory grief, also referred to as anticipatory loss or preparatory grief, is the distress a person may feel in the days, months, or even years before the death of loved one or other impending loss. It's the experience of knowing that a change is coming and starting to experience bereavement in the face of death. Many of us have experienced anticipatory grief without realizing there is a name for it. Some experts say anticipatory grief, when managed with coping techniques, can lessen the pain of post-loss grief. Others argue grief before loss has no effect, no grief after loss. Who has anticipatory grief and when? Patients with a terminal illness, as well as their family members, friends, and caregivers, often experience anticipatory grief. However, any kind of looming change can bring on anticipatory grief. This is true even if the change is exciting and anticipated and chosen. For example, a person who puts in notice at her job may grieve the loss of friendship. Scenarios that may provoke anticipatory grief include, but are not limited to, diagnosis or progression of degenerative disease, such as Alzheimer's disease, other forms of dementia, or Parkinson's disease. In one study conducted in Cork, Ireland, 29 people caring for a family member with Parkinson's filled out questionnaires to assess their levels of anticipatory grief. Caregivers were preoccupied with thoughts about what life could have been if they were never diagnosed, researchers found. End-of-life care. Anticipatory grief may affect the caregiver, the patient, or both. In one study of family caregivers in Japan, a woman taking care of her husband, a cancer patient who was accepted to die within 6 months, said, "I become anxious thinking about the future even I am asleep. What should I do? My husband is the firstborn son. His 92-year-old mother is still doing well. He is genuinely firstborn. Everyone in the household relies on the firstborn son, and everything important is left to him. If he dies, everyone will be troubled." Caring for children with chronic disease, hereditary cancer risk. Anticipatory grief often surfaces in people who have genetic conditions that elevate their cancer risk. In these cases, the patient imagines when a cancer diagnosis may come and how it will change their quality of life. Awaiting an organ transplant. Besides grieving the possible scenarios of their own death, patients on a heart transplant list were also grieving in this way for their potential heart donor and the death that would have to happen to extend their own lives. Amputation. A review of 134 studies of the social and psychological challenges that face amputees found that the time before the operation can be the most upsetting. Patients express grief over the unknowns surrounding their future, including pain, financial difficulties, general health, and future functional capabilities at home or on the job. Impending loss of a pet. A new job, a new relationship, a geographic move, or a teen leaving home for college. Even planned desired life change can prompt anticipatory grief related to the prospective loss of identity, friends, or routine. Anticipatory grief can also surface around pregnancy and childbirth, including in utero complications. Parents who learn that their unborn baby may not survive can experience anticipatory grief around the potential loss. Premature birth. Anticipatory grief may set in as parents mourn the loss of their imagined or wished-for baby, as they struggle to develop a bond with the real baby. In some mothers, these feelings may be rooted in her belief that her inability to bring her baby to term is a personal failure. What you might feel when experiencing anticipatory grief. People undergoing anticipatory grief report a range of feelings that may include anger or irritability, anxiety, denial, the desire to withdraw from social situations, desperation, dread, guilt, an intense preoccupation with the dying person, lethargy or lack of motivation, loneliness, loss of control over one's emotions, sadness, cheerfulness. The stages of anticipatory grief. There is no set order to what you might feel as you undergo anticipatory grief, and there is no finishing one feeling before you move to the next. You may experience many emotions one day and none the next. You may think you're done feeling certain emotions only for them to return days or weeks later. With that in mind, here are 4 phases a person with anticipatory grief may experience. Accepting that death is inevitable. This phase often co-occurs with feelings of sadness and depression. Feeling concern for the dying person. For family and friends, this phase may express itself in regret. For example, feeling regret over past arguments or disagreements with the person they are about to lose. For the dying person, this concern may translate to fear of what it's like to die. Rehearsing the death. A person may become focused on funeral arrangements, saying goodbyes, and other concerns related directly to what will happen in the time immediately surrounding the impending death. Imagining the future. Family and friends may envision what life will be like without their loved one. This phase may include visualizing holidays and other special occasions without the person or thinking about objects that will be left behind. The person dying may think about similar scenarios, wondering what it will be like for their loved ones to experience life without them. The dying person may also imagine what their own experience may be like after death, what, if anything, comes next.